In the health science program at Siegel, we've been running this program, I think, since the school started. Ideally what you want to do is come in as a freshman, and you would start out with health science education. And then you have a choice of classes. You can either go to medical therapeutics, or you can go to rehab careers. After that, everybody meets back up their junior year, ideally, in your honors anatomy and physiology course. And then at the end, you have a chance for a capstone experience, which would either be nursing education or clinical internship. And both of those are hands-on experiences where you get to go out into the community and experience what it's like to be a healthcare provider. Our program is growing really large. We are pretty full right now, but there's always room for more growth, and so we do encourage everyone to sign up their freshman year. You will have the opportunity to have guest speakers as well that are currently in the healthcare field, and this is one of the fastest growing fields that we have in Rutherford County, so we encourage you guys to join up and be a part.
I'm Kinsley.
And I'm Sophia.
And the reason I chose health science was because I'm interested in going into the nursing pathway. And I learned a lot from this experience so far, even though I'm just a freshman. And I've enjoyed everything about it. I feel like it's very fun and very hands-on. And it's a lot more than just like the basic things you think that you are. So if you're an 8th grader, like even interested at all, and I know they have a new thing there for 8th grade, so I would encourage you to, if you're in that, or maybe if you're not and you're just thinking maybe this is something that interests me, I would encourage you to get into that because I've enjoyed it, and I would encourage anyone else to because it's not that difficult, it's just very fun.
I chose the health science pathway because I want to go into the medical field, and this class, the pathway, really teaches you a lot about it and gives you a lot of good opportunities for when you're an upperclassman to be able to intern as a nurse or in a clinical facility. And they give you a lot of opportunities to intern the athletic trainers, and it's just a good experience overall.
Good morning. My name is Lisa Snetzinger. I am the nursing education instructor here at Siegel High School. Nursing education is a senior level course. It is a class that seniors will take after they have completed health science during their freshman year, medical therapeutics or rehab during their sophomore year, and then anatomy and physiology their junior year. The nursing education program is a application process. I take 12 students into the program, so I will send out information to prospective candidates. They will fill out an application as well as submit teacher recommendation forms. I will review those, do an interview, and then after I have completed the interview process, then I will choose the 12 candidates that are selected to be a part of the nursing education program during their senior year. It is a 2-period class. We meet Monday through Friday, first period and second period depending on the block schedule. Our class consists of instruction as well as clinical practice. As you can see in the background, we do have a clinical lab set up within the classroom, but the class also entails the students being able to go to Adams Place, which is a long-term care facility, to complete skills with real-life patients. Upon the completion of our coursework, the students do take a certified nursing exam. It consists of a written portion as well as a skills portion, and if they successfully complete that, then they obtain their CNA license, in which they can utilize out in the real world and practice as a CNA. Most of the students, or all of the students that are a part of this program, are moving towards a post-secondary education to become a registered nurse, and then possibly even advancing to become a nurse practitioner. So this program is geared for those students that have an interest in becoming a nurse.
Hello, this is the health science path, and one of the main aspects of it is HOSA and classes as well. In HOSA, we'll volunteer for many events such as an Alzheimer's walk. As well, we have competitions that range from anything from nursing to medical math and many other aspects of the medical field. And some of the classes that you have to take in this path are health science, medical therapeutics, rehab, anatomy and physiology, and then once you finish those, you can choose to go into nursing education and get your CNA or medical assisting. And
A little bit about the nursing education pathway is that you get to go to Adams Place and do clinical hours, and you also have in-class hours. You learn about different types of skills, and there's a lot of book work, but it's really worth it.